Hi guys, welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery by two board-certified plastic surgeons. I'm Dr. Smita. I am a surgeon down in New Jersey, and I am joined today with my co-host, Dr. Amalfi, who's up in Rochester. And we've got an awesome topic for you today. I think pretty much every single person wants to know the answer to this, because I think at some point everybody thinks about some sort of plastic surgery procedure or treatment or whatever. And we are going to answer the question, who is a good candidate for plastic surgery? Which I think a lot of people sort of think about this for the weeks or months that they're considering doing research, doing all this stuff. They don't know if they're a candidate, if this is the right option for them, and all of those things. So we're going to sort of break it down, keep it pretty straightforward, general, but just answer your question, if you're a good candidate or not.
Absolutely. I think people are, worried, and they have like a stigma in their head of what plastic surgery looks like. And usually that's not what plastic surgery looks like. Usually that's a person who's had way too much plastic surgery or not good plastic surgery. And I think people are like, well, am I really a good candidate? I'm just sort of an average person is what I'm looking for. Really right. And I think the biggest thing is to just have realistic expectations, right? Like, you actually don't want to look super different or super weird. You just want to be the best version of yourself. So I think having realistic expectations of what you want to get out of your procedure is probably one of the biggest things for me that makes you a really good candidate. Do you agree?
Yeah, I agree. I think having realistic expectations and then being able to verbalize those those goals and those expectations to us is also really important. I always joke, what you said reminded me about this, but I always tell patients, if you notice that somebody's had something done, it hasn't been done well, right?
Exactly.
Because that's like what people are so worried about, right? They don't want to look fake. They want to look like themselves. Well, most people who get things done, you would never know, right? So they look like us. Yeah.
You want them to wonder. You want them to wonder and be like, wow, he or she looks like amazing, or they're just like glowing, like what's happening. You want people to question that, but you don't want to walk in a room and be like, hey, this is exactly what this person had done, because then it's overdone.
Overdone.
You want,
right.
You want that tasteful, like natural looking result. And, just communicating those goals with your plastic surgeon and making sure that your plastic surgeon is really someone who's going to achieve that. Like, look at their website, look at their social. Do their patients look like you want to look?
Well, I always also say, if you go into their office, like, look at everybody, everyone who works there, look at the surgeon, right? If everybody in the office looks overdone and the surgeon looks overdone, well, then that's their aesthetic, and most likely you will walk out of the office looking overdone. So, granted, some people, no judgment, some people want that overly exaggerated look, right? That's what they're looking for, and by all means, go for it. But if that's not what you're looking for, then, I feel like we're our sort of biggest or best billboard, right? And a lot of patients that are sort of nervous, I'll tell them, like, oh, well, I had Botox done and I'm still moving, or I've had fillers and I don't look like I've had fillers. So, so just look around, pay attention. But yes, number one, know your goals and be able to communicate that with us. Because at the end of the day, we want to make sure that you get what you want, and then we understand what you're trying to say, and we can deliver that.
So what's another thing that you think makes someone a really good candidate for plastic surgery?
Well, I think this sort of ties in, and we sort of talked about it, a little bit. So, knowing your goals, but also having realistic expectations, right? I think all of us want to look like we're 10 years younger, or we have zero blemishes, or zero wrinkles, whatever. But at the end of the day, plastic surgery has limitations, and we have to make sure that our goals sort of meet those expectations, because one true way of being unhappy at the end of this whole journey, both the patient and the surgeon, is if we didn't have appropriate expectations to begin with, or we promised them and we couldn't deliver because that surgery just wasn't able or can't do that in the best of hands. So I think that's a big thing, right?
You need a surgeon you can communicate with, because you want to be able to tell him or her exactly what it is that you're looking for, but you also want them to say, yes, we can do this, but these are the limitations. And if you find someone that you feel like you have good communication with, then chances are that you guys are speaking the same language and you're going to get a result that you're really satisfied with, and that's what's most important. How about something else like general health? Like I think people underestimate that plastic surgery is still surgery, and so a good candidate for plastic surgery also should be healthy. So this is not like a weight loss excuse or operation. This is really a surgery for healthy people who don't have a lot of other medical illnesses going on and really just want to optimize their bodies. So do you see people who get kind of confused about that?
Oh yeah. I mean, I think, especially with liposuction, I think I, see it probably the most common with that patient population. And I think, it's liposuction, right? We're sucking out fat. You just assume, if you have that extra 10 pounds, 15 pounds, you'll just get liposuction. It's a quick, easy fix. But at the end of the day, that's not accurate, right? All of these procedures should be done when you're at a stable weight, you're healthy, you have a healthy lifestyle. And these are really for those stubborn areas that are not going to get better no matter what we do, right? Whether it's loose skin, those stubborn areas of fat that no matter what are not going to go away. So that's really where plastic surgery comes into play, and that's really what's going to give you the best results at the end of the day.
Yeah, absolutely. So you want to be healthy, you want to be in a good place, but you also want to have healthy habits. Like you don't want to be smoking and drinking excessively. You want to be in addition to a very healthy lifestyle. You don't want to be doing all those negative behaviors. You want to be doing positive behaviors. You want to eat well and be working out and be just in general having healthier habits as well. And so I think people downplay things like smoking, saying, oh, well, I've had, other surgeries before and I was smoking and, eating fast food and it didn't really matter. Well, this is different. This is elective, and we really need you to have a safe outcome. And what we do is really pushing the limits to get you the results that you want, and we have to do that safely. And a lot of those lifestyle decisions will really negatively affect surgery, which I think is something that patients really need to understand coming in to plastics, right?
Yeah, I mean, right. I think, like you said, number one, it's completely elective. So we're not we're not removing cancers or, saving lives. This is sort of a lifestyle confidence improvement, things like that. So we are going to wait to make sure that you're in the best place health-wise to do these procedures. But plastic surgery is so different than other surgeries, right? I trained in general surgery before. A lot of our incisions are laparoscopic. So you have these 1 centimeter little incisions, or even if for bigger surgeries, you're just cutting straight down. It's like cutting just a piece of a cake, right? You're just going straight down. So all those blood supply, those vessels are still attached. With plastic surgery, we're sort of just like peeling the layers off, right? And we're making these huge incisions. We're really reshaping and contouring the body. So we're really stressing the blood supply, to our skin and our soft tissues. And so we really need those vessels to be nice and big and open. And they're not going to be if you're smoking and things like that. So, so that's why we're such sticklers about all of that. But at the end of the day, you need to have a good outcome. It's always better to wait to ensure that you have a better outcome than to sort of rush into things. But I also think for anesthesia, right? Anesthesia, a lot of these surgeries, especially our big combination surgeries, mommy makeovers, it's all under general anesthesia, and they could be long, upward of 6 hours or for anesthesia. So we want to make sure that you're healthy so that you recover well from that as well.
Absolutely. Yeah. We want you to take this seriously. You're a good candidate if you know what you're looking for, if you're healthy, if your lifestyle is ideal. And if you have like a really realistic expectation of what you're going to get out of surgery, and you find a plastic surgeon that you mesh with, that has the same aesthetic as you, and you feel like you've really communicated, then that's going to ensure that you're a good candidate for plastic surgery, but also that you're going to have a really great outcome, which is ideally what we want for all of our patients.
Right, exactly. And I think the biggest take home is just really be honest with your plastic surgeon, talk to them about all of these things, and we'll help guide you. You know, if there's things that we can improve upon, things we need to talk about, that's all a conversation that we'll have. Again, so that we can plan accordingly and make sure that you do the best that you can.
We gotcha. It's going to be awesome. So we know if you're good, give us a call. We're excited to talk to you.
Awesome. Well, this is a good topic. I think this sort of covers really any sort of elective surgery, not even just in plastic surgery, but especially plastic surgery. But it's important to know that at the end of the day, safety is most important.
Absolutely.
Yeah.
Thank you, guys.
Thanks. This is a great episode. Make sure you subscribe. Lipstick and Lipo on YouTube. See you later.
See you soon.